your station. Right. So if you have read and understood, considering it history taking station, please begin.
Okay, good evening. My name is Dr. Daniel Raza, and I'm a surgical doctor. I would like to confirm your name and age, please.
Yeah, I am Nancy, 66-year old.
Pleasure to meet you. So today I'll be
Nice to
asking
meet
few questions regarding your health. Is that okay?
you. It's okay, yeah.
All right. So what has brought you here today?
Yeah, there's a lump in my neck.
All right. I'm so sorry to hear about that. So let's work together to find some relief. So since when you have been experiencing this?
Yeah, less than a year. I first noticed about the lump in my neck. Now, I I very worried because the lump began growing so fast.
Okay. So did it start suddenly or gradually?
As well, it started gradually, but sudden within less 2 months ago, the lump began growing rapidly. Yeah.
Okay. So is it painful?
No,
All right. So is it any specific time in a day that you can see that the lump increases in size?
not like that. It's always the same.
All right. So what do you think? What are things that increase its size or decrease the size of the lump?
I don't know that.
Okay. So have you been having any difficulty in swallowing?
Yeah, I cannot eat my food well. It's very difficult to swallow.
And also, do you have any difficulty in breathing?
Yeah, sometimes it's very difficult to breathe. Yeah,
Oh,
yeah.
okay. And how has your appetite been?
Yeah, I cannot eat very well.
Okay.
I don't want to
So
eat either.
do you experience any weight loss?
Yeah, and in the last month, I noticed that I have lost 4 pounds.
All right. Okay. So, do you feel any cough?
Sorry,
Do you feel any cough with that?
I know.
Okay. So, do you experience any hair loss?
He,
Oh,
hearing loss. Sorry, what?
hair loss. Hair
Hair
loss.
loss, hair
Hair
fall.
loss. Oh, yeah. No, no.
Okay. So, have you experienced any change in the size of your eyes?
Uh, no. I don't know that.
Okay. So, did you have any changes in your vision?
Uh, no.
Okay. So, do you think that your heart races up?
Yeah, sometimes I own my happy year. I know my happy year.
Okay. So, do you have any difficulty in sleeping?
No, no.
Okay. Any changes in your bowel habits?
Well, no.
Okay. And do you see any changes in your mood throughout the day?
Yeah, sometimes I began every day and agitated or without any reason.
Okay. So do you feel any intolerance to cold or heat?
Yeah, I afraid of heat.
All right. So do you see your GP for any other medical conditions?
Apart from the nurse running, there's no reason. Yeah.
Okay. So do you take any medications regularly?
Yeah, I take the Sandra given by GB for my thyroid.
Okay. So do you take any medications for that?
Yeah.
And do you know the name and dosage?
I don't
All right.
I
So
don't
do
remember
you,
now. Yeah.
okay. So do you have any allergies?
No.
Any history of blood transfusions?
I know.
All right. So is there anyone in your family has had the same complaint?
Yeah, my grandmother had the same complaint. Yeah,
Okay.
same condition.
All right. So do you mind if I ask you some personal questions?
No. Yes. Okay.
Great. So what do you do for a living?
Yeah, I was a retired school teacher.
And whom do you live with?
Yeah, I live with my family.
All right. So do you smoke?
No, I don't.
And do you drink alcohol?
Yeah, sometimes. Yeah, no, just okay. Just a social cases.
Okay. All right. So what do you think the cause of this lump is?
Yeah, my GP said that I had the sand disease in my thyroid. It is not worry. Yeah, but I really worry about the land is became very bigger in this day. I cannot eat well and I cannot sleep well.
I can understand. So what
Yeah,
are you most concerned about?
yeah. I afraid of the. Do you know that I afraid of the cancer and I worry about it.
Okay. So, and what are you hoping us to do for you?
Yeah, I hope you can help me to remove my worry about the cancer and also my land. Why the
Okay.
Yes,
Can you please
definitely.
summarize your history now?
Yes, today I have taken a history from 66 years old a lady who is a retired school teacher and she has no prior comorbids. She presented to me with a complaint of the lump in the front of the neck that
Yes.
is there for around 10 years and that has progressively increased in size within the past few months. The lump is associated with the compressive symptoms and she has been having difficulty in swallowing and breathing and has lost 4 pounds of weight in the last 6 weeks.
All
And
right.
she feels irritated throughout the day. And
So what are your provisional and differential diagnosis for her?
my provisional diagnosis would be thyroid carcinoma,
Yes. And
and it could be hyperthyroidism due to goiter.
yes.
And the other thing would be thyroiditis, but
Okay.
least likely because there is no pain.
So what are the investigations that you'll ask for her in order
Yes,
to
yes.
include your diagnosis? Yes.
When it comes to investigation, I would proceed with the baseline investigations that include complete blood count, urea creatinine electrolyte, LFTs, and clotting profile, and proceed with the thyroid profile that includes TSH, free T3, and T4 levels. And I would go for the imaging that includes the ultrasound scan of the lump and proceed for the FNAC.
What is the triple assessment done for
Yes.
thyroid swelling?
Yes,
Please.
ma'am. Triple assessments includes the history and physical examination
Yes.
and the imaging with the ultrasound
Yes.
and the FNAC.
Okay. What treatment would you offer this lady?
Yes, as she has the strong suspicion of thyroid malignancy, I would want to discuss it in the MDT and to come up with the definitive management that includes the thyroidectomy, hemithyroidectomy, along with the neck dissections of the lymph nodes.
Okay. If you just go for the surgical or the invasive management for this patient. So what are the complications that you should be aware of or you should warn the patient about?
Yes, I would counsel the patient regarding this is the very large goiter, so there will be a risk of tracheomalacia, the recurrent laryngeal nerve damage, and the iatrogenic parathyroid removal, and the hypocalcemia in the post-op period.
Yes. And nerve
And
injuries?
Yes, ma'am. The recurrent laryngeal nerve injuries or the superior laryngeal nerve injury, and there could be the risk of bleeding as well.
Okay. All right, good. Thank you.